Hi, my name is Makenzie Neace. I'm the student pharmacist here today. Do you just care to verify your name, your date of birth, and your address for me?
William Brayton Fugit, 12553, 75 Joybray Lane, Jackson, Kentucky.
Okay, thank you. Do you have a few minutes to talk about the new RX you're prescribed?
I sure do.
Okay, well, it looks like you were prescribed hydrocodone tablets, 10 milligram. Did your doctor explain to you what you'd be taking this medication for?
Pain.
Okay, yes. This medication is going to help alleviate your pain that you've been feeling in your hip. You should start feeling its effects within a couple hours of taking your first dose. Do you know how you're supposed to take this medicine?
I do not.
Okay, so what you're going to do is you're going to take this medication by mouth every 12 hours. It's really important with this medication that you put it in your mouth and you swallow it with a lot of fluid, water at once. You do not chew it or crush it because that can really affect how the medicine is administered once you take it. If you miss a dose on this medication, don't double up. It's okay if you miss a dose, just start with the next dose and skip that one because you don't want to take too much of this medication at one time. There are also some serious side effects that you should monitor and look out for. One of the main side effects that occur with this medication is difficulty breathing. So if you experience difficulty breathing or feel like your breathing has changed since you started this medication, contact your doctor immediately. Also, if you're feeling extremely dizzy or if you pass out, anything like that, that's something you should contact your healthcare provider about immediately. There's common side effects that aren't as serious, such as like constipation, and a little dizziness is sometimes normal. You'll feel weak, tired possibly, but they should go away with time. If they bother you extremely or if they don't seem to be going away as you take the medication, talk to your doctor and we can work something out. Do you drink any alcohol?
No, ma'am.
Okay, if you do, you need to talk to a doctor because alcohol and this medication does not mix. It's not something you should be doing at the same time. Are you taking any other medications?
No.
Okay, that is, if you start any other medications, you should also talk to your healthcare provider about it to make sure they're safe and not interactions. So, what questions do you have for me so far?
I feel like you pretty much covered all the things I need to know.
Okay, so you're going to want to store this drug at room temperature in a dry place. So keep it out of bathrooms, away from showers and moisture. A lot of people prefer just like a kitchen cabinet. That's a good place for medicine. Do you care just to repeat how you're going to take this medicine?
Orally, by mouth, with lots of water, on an empty stomach, or if not. If it bothers me with an empty stomach, then try taking it with some food in my stomach.
Alright, and just make sure you never like crush it or chew it, just swallow it whole. Do you feel concerned about any of the side effects, or do you think that you'll be able to monitor that?
I should be able to monitor that.
Okay. Well, if you have any concerns or questions at any time, before or after starting this medication, please do not hesitate to call. We will be happy to help you.